In Health Watch, the state of Minnesota today issued its own COVID vaccine recommendations. They differ dramatically from those recently announced under the Trump administration. This comes after an executive order by Governor Tim Walz to maintain vaccine access. Our Jason Rantala shows us how the state will try to ensure those who want the vaccine can get it.
In an unprecedented move, Minnesota is straying from federal COVID vaccine guidance.
The recommendations are that every adult should also be vaccinated.
On Monday, the Minnesota Department of Health issued a standing order empowering pharmacists to give COVID-19 vaccinations to those who want it. MDH recommends the vaccine for those 6 months and older, while strongly recommending it for people with underlying conditions. It comes amid drastic changes to vaccine guidance under President Trump's Secretary of Health and Human Services, Robert F. Kennedy Jr., a known vaccine skeptic. Most recently, the CDC voted to drop the recommendation for most adults to get vaccinated. In August, the FDA limited COVID-19 vaccines for most age groups. But Minnesota health leaders say vaccines are one of the greatest achievements in modern medicine.
Vaccine can prevent severe disease. And we want people to use the tools that we have available.
The state says they followed guidance from the American Academy of Pediatrics and the American Academy of Family Physicians, among others. Those associations recommend the vaccine for kids under 2, pregnant women, and anyone with high risk for severe illness. They say that allowing widespread access, despite the new federal restrictions, is key.
We wanted to ensure that anyone in Minnesota who wanted protection against severe disease from COVID-19 should be able to receive the vaccine.
But will insurance cover the vaccine?
And we are optimistic that there will be coverage.
Linfield says she hopes to learn more in the coming days, but an executive order from Governor Walz started the conversations between MDH and insurance providers.
We just need to wait a little while for the insurance companies and the health plans to catch up with everything that's been happening.
Last season, MDH says there are just shy of 6,000 people hospitalized for COVID in the state, but most were 65 or over. As for how bad COVID will be this year, Linfield says that's just too hard to predict. Frank?
Well, let's hope mild, Jason. Thanks.